Hi, my name is Daniel Zarate, and this is Unraveling the Web of Addictions and Network Analysis Approach. The last 20 years saw a shift in how we understand and think about addiction, incorporating the idea that addictive behaviors can be identified in relation to seemingly enjoyable activities and not only the use of substances. Particularly, scholars suggest that both substance addictions and behavioral addictions respond to similar drives or needs in individuals influenced by internal and external factors precipitating similar neurological processes. Previous research proposed that all addictions have common components indicating the existence of problematic behaviors, including excessive preoccupation with the behavior or activity, engaging in the behavior or activity to change mood state, inability to fulfill daily obligations due to excessive engagement with the behavior or activity, increased engagement with the behavior or activity to obtain the same level of satisfaction, return to the behavior or activity after a period of controlled use, and irritability in the absence of behavior or activity. It's been theorized that behavioral addictions can include a diverse range of behaviors such as excessive online gambling, hypersexual activity, problematic internet use, disordered online gaming, problematic social media use, compulsive shopping, and problematic exercising, among others. Considering the current debate in the field warning that an emphasis on addiction could lead researchers to overpathologize everyday activities, many of these problematic behaviors have not been formally recognized by diagnostic manuals such as the DSM or the ICD. A body of research suggests that addictions tend to co-occur rather than present in isolation, with a comorbid presence of problematic behaviors increasing the likelihood of further developing problems in two important ways. Firstly, common elements may facilitate a cycle of reciprocity, exacerbating the risk of transitioning from one addictive behavior to another. For example, one abuses alcohol and while drinking progressively develops disordered gaming behaviors. Secondly, individuals may seek gratification through alternative addictive behaviors while aiming to disengage from a previously established addiction. For example, drug abusers may substitute their use of substances with alcohol while aiming to abstain from the first. There is a vast evidence examining interrelation between different forms of addiction, and this has been produced via correlation analysis, logistic regression, chi-square, and structural equation modeling, among other methods. These methods place emphasis on commonalities across different forms of problematic behaviors at the construct level. In other words, these methods view problematic behaviors as syndromes inclusive of various symptoms rather than examining how distinct symptoms of different addictions may link with each other. For example, how preoccupation with gaming may relate with alcohol withdrawal. Additionally, these methods provide limited insights into the relative importance of certain problematic behaviors compared to others. For example, whether mood modification is more central or important compared to relapse and interpersonal conflicts for the diagnosis of pathological gambling. These notions can be addressed with a network analysis approach. Firstly, rather than emphasizing interrelations at the construct level, network analysis evaluates relationships between psychopathology symptoms. For example, gaming preoccupation, gaming tolerance, and gaming withdrawal. Therefore, rather than only evaluating comorbidity between constructs, network analysis allows the examination of comorbidity of symptoms within and across disorders. Secondly, network analysis provides centrality indices to assess if certain symptoms are more influential in the network structure. For example, understanding the influence of a particular form of addiction and how that may vary across its symptoms could provide crucial knowledge for addressing addictive comorbidities and substitution of problematic behaviors. So, based on this information, on the information that we have discussed so far, we wanted to answer two research questions. Firstly, what is the network structure of an extensive series of symptoms of addictive behaviors and use disorders, including a range of problems? Secondly, Which symptoms of such problematic behaviors are more central or influential in the maintenance and development of new problematic behaviors? So now we move into the method section. After getting ethics approval, participants were recruited via crowdsourcing platforms and completed an online questionnaire. The sample consisted of 968 adult English speakers from USA, UK, Australia, and New Zealand, with a mean age of almost 30 years old. 64% were men, 32.8% were women, and 3.2% were non-binary. The data was collected between November 2020 and January 2021. All instruments used to assess problematic behaviors have been extensively used in research and have shown robust psychometric properties. Additionally, in this study, all instruments show good internal consistency. Now, to investigate the interrelations between symptoms of addictive behaviors, we use a lasso regularized regression with 1,000 non-parametric bootstrap resampling. This included 79 symptoms of 10 forms of addictive behaviors, including disordered internet use, problematic online gaming, hypersexual activity, disordered social media use, problematic shopping, problematic gambling, alcohol abuse, drug abuse, problematic smoking, and compulsive exercising. As we see here, the network as we see in this network graph, the symptoms or nodes are indicated by the little circles, and relationship between symptoms or edges are indicated by the lines. The lines can be blue or red, and that indicates positive or negative relationships. And the thicker the lines, the more stronger the relationship. Here we see a plot of centrality indices to assess which symptoms were more influential in this network. Central or influential symptoms included asked someone for money due to gambling, needed a first drink in the morning, abuse more than one drug at a time, feel guilty about drug use, neglected your family because of drug use, and prioritize gambling over other areas. We also want to assess the importance of problematic behaviors grouped by the corresponding disorder. And as we see here, drug abuse was the most influential disorder, followed by alcohol abuse and disordered online gaming. Finally, we were interested in identifying bridging symptoms that may influence the development of comorbid symptoms belonging to a different disorder. As we see here, bridge symptoms with the highest frequency of inter-disorder connections included use drugs for other than medical purposes, had blackouts or flashbacks due to drug use, and need to spend more and more money in gambling to get the same desired high. Now, some important implications to highlight from the results we just discussed. Firstly, there were stronger relationships between symptoms within the same disorder, and this is in line with previous studies. So this reinforces the idea that each presentation has uniquely distinct elements differentiating all forms of addictions or problematic behaviors. In other words, addictive disorders should be conceptualized as different sets of addiction symptoms that do not necessarily co-occur under a more diagnostically loose addiction entity. Symptoms related to gambling, drug, and alcohol abuse display the highest level of influence or centrality within the overall network of addictive behaviors. In other words, these symptoms are connected more frequently and more strongly with other presentations of addictive behaviors and may be seen as risk factors for increasing the negative impact of current symptomatology. Symptoms primarily related to drug abuse and disordered gambling were frequently and strongly connected with other forms of addiction. In other words, These symptoms may be seen as increasing the probability of developing further problematic behaviors, either in the context of comorbidity, substitution, or replacement of current problems. The current study supports the notion that different forms of addiction encompass uniquely different disorders. Although all problematic behaviors may be assessed by an underlying common element, for example, salience, mood modification, tolerance, and so on, apparent differentiations pose the need for the independent assessment. Our findings indicate that symptoms related to compulsive gambling, disordered drinking, and drug abuse, and for example, some of these symptoms may be negative financial consequences, excessive preoccupation, guilt, and interpersonal strain due to the presence of other behavior, may pose a more significant risk for expanding one's addictive difficulties. And as such, clinicians may want to prioritize interventions in relation to the symptoms we just highlighted. So that's it for this presentation. Thank you so much for your attention, and please feel free to forward your queries. Thank you.